Do you get some knee pain while you're doing squats? Chances are you might need some more knee stability. Keep watching. Before we get into exercises for knee stability, it's first important to understand which muscles actually control knee stability. Now, when it comes to stabilizing the knee within an exercise like squat, and this also applies to other exercises like the Bulgarian split squat, pistol squat, the lunge, all those exercises as well, you have to understand that your knee lateral motion is controlled by two main muscle groups, the hip abductors and hip adductors. Now, the hip adductor muscles are found within the inner thigh, and the hip abductors are found at the hip and the buttock region. And it's really important that we stimulate both of these muscles to co-contract so that the knee has an even amount of pull in both directions and therefore have good alignment while you're doing your squat. So what do the hip adductors even do? Well, actively what they do is they contract to pull your leg in towards the midline. But in terms of stabilization, what they do is prevent excessive hip abduction, which is the leg moving away from the midline. Contrary or in complete opposite of the hip adductors, you have the hip abductors. And the hip abductors function primarily to raise the leg away from your body's midline or prevent excessive inwards movement of the thigh. Now, both of these muscles have to co-contract, which means contracting at the same time in order for your knee to stabilize right in the center region. In a way, you can think of this as like a tug of war between the two muscle groups. And sometimes when the war is won on one side versus the other, you can have knee issues. These types of knee issues tend to be more prevalent when you start to fatigue. Usually when you're fresh and strong and just starting to work out, the knee doesn't really get bothered, but as you continue and start to fatigue, you might start noticing that your form deteriorates, and this might result in some knee pain during or after working out. So how do you know you need to do some more knee stability? Now, one of the things you might notice while you're doing a squat is an inward or outward movement of your knee during that movement. And this can be very transient where it happens for a moment during that squat, or it can happen throughout the whole entire movement in either direction. In some cases, you might not actually see any deviating movement at all, but you might still feel some discomfort or pain in the knee. So today's video, we're going to go over some different exercises that you can do for that knee to stimulate the right muscle groups to turn on while you're doing your squats. But before we go into our exercises, there are two different ways to approach these exercises. One is to do a single set as a warm-up, and what this will do is prime those muscles up so that you can actually utilize them to the fullest capabilities while you're doing your squat. And second, you could do them more frequently, about 3 times a week on a consistent basis, just to develop better intrinsic stability of your knee. The second way of doing things is the way I prefer to do things, because I'm the type of guy that doesn't want to have to rely on a warm-up to do an exercise. In fact, I actually prefer that you have the innate ability with no warm-up at all to do these exercises, because that's how you know, or you truly know, that you're all good to go. All right, let's get started. For these first set of exercises that we'll be doing, you're going to need a light monster band. The exercises in this series are going to be considered RNT exercises or reactive neuromuscular training exercises. Basically, you're going to use a band as a form of resistance to stimulate certain muscle groups to turn on. So first, we're going to start with the hip adductors or inner thigh muscles. You're going to anchor the band to something stable like your squat rack at about knee height. From there, you're going to loop the other end of the band around the affected knee above the knee joint. Once you have that band looped around your knee, you're going to take your squat stance and you're just going to do a squat, making sure that your kneecap, the apex of the kneecap, which is the tip of this triangle, follows along the second to third toe of your foot or the midline of your foot. So from there, you're going to maintain that and you're going to do a squat. Now you want to do this exercise at a roughly 5-second tempo. The reason why we're going a little bit slower is so that we can stimulate better knee control throughout the whole entire movement. So I'm going to come down, do my squat, and you might actually notice that with this band stimulating the hip adductors to turn on, that your knee pain actually is not that bad. It can take away that pain. And you could do this under load as well during your warm-up, and this will stimulate the hip adductors to turn on. Now, in certain circumstances, this actually might make your knee pain feel worse. If that's the case, don't do this exercise. It just means that it's likely the opposite muscle group that you have to train up in order to stabilize your knee. For this exercise, just because we're trying to stimulate these muscles to turn on, if you're doing this as a warm-up, you want to do it in non-fatiguing repetitions. So that'll be probably about 8 to 10 repetitions. If you find that 8 to 10 are fatiguing, then you're just going to stop doing the exercise as soon as you start noticing that your breath gets a little labored. Like I mentioned, the second way to approach this set of exercises to actually do this exercise in sets of 3. So you'll be doing 3 sets with about 1 minute rest in between, and you'll be doing anywhere between 15 to 20 repetitions. We're going to be reaching a little bit of fatigue, but shouldn't be burning you out completely. Now, the second exercise we'll be doing is going to be a single leg version of it. So you're going to do a single leg squat from this position. You're going to have the same band orientation and placement, except for you're going to raise the other leg off the ground. We're going to go down until your thigh reaches parallel to the ground. If you can't go that far because your single leg knee strength isn't that high, that's okay. You could take a split stance orientation instead and use that other leg to just kind of support you at that bottom of the movement. And you'll feel these muscles turn on. Next, we'll be doing something similar, but instead we're going to grab a loop band. So I'm going to go grab one right now. So now I have my heavy loop band. This is the heaviest one I have that's rated. And you want to go as heavy as you can handle without you breaking form. So from here, once again, you're just going to loop that band around both of your knees above the knee joint. And if you want, you can go lower than below the knee joint, but it'll be harder for you in terms of exercise difficulty, which is fine if you can handle it. But today, we're going to start off with an easier version. From there, you're going to do the exact same squat you just did. So you're going to do your banded squat, making sure, once again, that the apex of your kneecap goes over your second or third toe or along that midline. And once again, you're not just going to bang out these repetitions. You want to take your time while you're doing them. Take about 5 seconds or so to complete each repetition, going down, controlling that knee. You're going to feel those hip abductors turn on, which are mainly your gluteus medius and gluteus maximus muscles. You want to make sure your feet stay flat on the floor while you're doing this exercise. Once again, you're going to do anywhere between 10 to 15 repetitions for 1 set if you're doing it for a warm-up, or if you're going to be going and doing 3 sets because you really want to work and develop these muscles and strengthen them for the long term, you'll be doing 3 sets of 15 to 20 repetitions instead. These sets should be pretty fatiguing, so you'll probably need about a minute of rest in between your sets. Now you can also use one of those fabric-based bands as well. I don't have one handy on me right now, but whatever will help your muscles turn on and stabilize that knee and make it feel better. The second exercise that we'll be doing for these hip abductors is going to be a pretty similar setup, but targeting the opposite muscle group as the hip adductors or inner thigh exercises. So once again, you're going to set up this band onto something stable, like a squat rack, and you're going to loop it around a single leg, the target leg, just above the kneecap. Once again, you're just going to complete repetitions of half squats. And if you need to, you can use that back leg to support you during this exercise so that you don't lose too much balance, but you should use this leg as little as possible during the movement. So from here, I'm going to come down, go until my thigh reaches somewhat to parallel. And from there, I'm going to come back up. Okay? So you're going to try to reach a full depth. It's totally okay to let that knee go past your toes in order for you to get the range of motion, the full range of motion, and then coming back up. Because the single leg version is a lot harder than the double leg version, you probably won't get nearly as many repetitions out. It's totally okay to only do 6 to 8 repetitions, if even that. If it's a higher demand exercise, chances are you're probably going to need about 2 minutes of rest, maybe even more, in order for you to recover with enough strength and energy to complete your second set. That's completely okay. At that point, you're just doing a lot of strength training in order to develop that knee stability. I hope you all enjoyed this video on how to do a few knee stability exercises to help stabilize your knee during your squat and making that squat pain-free. If you're new to my channel, please hit subscribe. If you're a frequent visitor of my channel, hit like, and thank you for viewing this video. If you all need help with your squat, we do squat assessments at our clinic in Rehab Hero, located in both Markham and Toronto. You could click the link in the caption to book an appointment. I'll see y'all next time. Peace.